I'm going to discuss the skeletal anatomy relevant to the thoracic spine and the injections pertinent to the thoracic spine. We're talking about the level counting to know what level you are at. There are two ways to do this. You could actually count the levels from the top, or you could count it from the bottom. When you start counting from the top, the first structure that you'll be able to see on the scanning posteriorly will be the second rib, given that the first rib is very flat and has a very horizontal orientation. The other way to calculate the levels of the thoracic levels would be to start at the 12th rib and then move the ultrasound probe up. And once you are at a level which concerns to you, you will then be able to move the ultrasound probe medially, and that will take you to the corresponding thoracic vertebra. With regards to the scanning technique for the thoracic vertebra, there are multiple structures you will be able to visualize, and that's why the skeletal anatomy is important. When you place the ultrasound probe in the midline, the structures that you'll be able to visualize will be the spinous process. Once you move the ultrasound probe slightly laterally, you'll be able to see the laminae, and followed by that, you'll be able to see the superior articular process and the inferior articular process, making up a thoracic zygopofascial joint. Followed by this, when you move the probe more laterally, you will be able to see the square-shaped transverse processes, and then on moving the probe further laterally, you'll be able to visualize the ribs. The way to differentiate the ribs and the transverse process, as you would see, the ribs are superficial structures and they also have round appearance as compared to the transverse process, which are slightly deep and do have a square-shaped appearance on the ultrasound. We're going to talk about the intercostal nerve block. To do the intercostal nerve block, start to scan from the midline. As we always do midline scanning, looking for the spinous process, moving lateral, looking for the lamina and the facet joint in the thoracic region, followed by that moving more lateral. Here we have the transverse process, and now we're moving lateral, and here we have the intercostal space with the two ribs, and here you could see I've just done a bit of a tilting for the rib so that we could see the intercostal space clearly. And now we have the intercostal muscles very clearly depicted in this particular image. I'm going to talk through the layers of intercostal muscle. We have a rib here, this is the external intercostal muscle. We have another layer, that's the internal intercostal muscle. Given that we're very close to the midloin, this is the innermost intercostal muscle. And then we have a pleura. To perform this injection, I always recommend you put the needle in plane, coming in and going at the level of innermost intercostal muscle. At this level, when you inject the local and steroid mixture, you will find the pleura being pushed away, and this is how you would perform the intercostal nerve block. The volume should be kept around 1.5 to 2 mL of local anesthetic and steroid. Given that there is a cross innervation, you will never do an intercostal nerve block at one level. You will be performing it at multiple levels. This is a vascular place, so you always have to make sure that you keep the dose of local anesthetic in mind when you're giving this block. Thank you.